I know most of you came for the healthy snacks, and Senator Wyden has assured me they are arriving any moment. It's all part of this incentive-based program, you know, we're putting together. But if you could do calisthenics while seated, we would appreciate it. I really do appreciate all the folks that showed up, and particularly those who've come so far to be here with us. And you're going to get to hear from them in just a second. And they are truly the experts and have a lot of interesting data to be able to present to us that helps us in terms of how we can improve Medicare, as Senator Wyden has said. And it's great to work with Senator Wyden on this bill, the Better Health Rewards legislation, and generally to work with him on a number of other issues. He's about results, and that's what we need right now in healthcare badly. Toby Cosgrove is here from the Cleveland Clinic. He's the CEO. He's also got with him Michael Roizen, Dr. Roizen in the back over here, who's the Chief Wellness Officer for Cleveland Clinic. They're doing some interesting things with their employees, and again, it's a great model, I think, for not just other healthcare systems, but really for this federal role. As Senator Wyden has said, we have a huge role to play, and we can do what we do much more effectively. The Wellness Institute is part of their operation. It was established back in 2008, and I've toured there. It's very interesting. They bring in customers, I'm not saying patients, it's more like customers from around the Cleveland area that are businesses that are interested in a wellness program for their employees, and take them through the process, help them get set up with their wellness programs. And it is a great model because, you know, it works. Companies see savings and they see healthier employees, and having visited and seeing firsthand some of the work they do with community members to achieve healthier behaviors and healthier life choices, it works. Their tobacco treatment center is there. They've also got exercise and diet expertise there and so on. Within their own operation, and I assume, Toby, you're going to talk about this some, but with their employees, they have now saved $15 million a year in 2011. So huge savings, and it's lowered the number of hospital admissions for employees with chronic illnesses. As Senator Wyden has said, that's part of the aim here. And with a $15 trillion debt and these trillion-dollar deficits and Medicare on a totally unsustainable path, we do need to find innovative ways and creative ways to save funds, and this is certainly one of them. The unsustainable path requires us to think a little differently, and I think that when you ask folks about how to change Medicare, you're going to get a lot of different ideas, and certainly Senator Wyden's been in the lead on some recent proposals that deal with the larger question of the Medicare program. But ultimately, I'm hopeful because there's so much potential to do better, not just in terms of the cost savings, but in terms of the quality of care. And again, this is one example of that. Senator Wyden talked about addressing chronic disease. Bottom line for me is that this bill begins to change the focus of Medicare from just dealing with people when they're sick to avoiding people getting sick in the first place. So it's a fundamental change of approach, and one that's going to lower overall health costs significantly, I believe, over the long run. And again, you look at the Cleveland Clinic's experience and others, you can see a model. It's voluntary. It's a 3-year program. We've set up over 3 years to give it a chance to operate and to see how it works, but also be sure that we get the data and the information to be able to determine whether it's the right way to approach this. It gives people a financial reward for achieving certain health goals. They're based on target categories, which we think recognize the best indicators of current health challenges, and one is diabetes indicators, one is body mass index, another is blood pressure, another is cholesterol levels, tobacco usage, and then of course screenings and specified vaccinations. And through this process, as Senator Wyden has talked about, of the initial physical, all these are going to be measured over time, and there will be rewards, based on folks following the indicators that, we think, again, are the appropriate ones to be measured. So I think it's a sensible way for us to proceed with a 3-year pilot program, and I think it's consistent with all the best practices we've seen around the country, and I'm delighted to join Senator Wyden in promoting this. Thank you, Ron.
Okay, thanks, buddy.